So hello guys, welcome to another session, and today in this session I'll be talking about one very important topic in hematology or pathology, that is inclusion bodies within red blood cells and white blood cells. So let's start with the first inclusion, that is OR rods. Now, OR rods, as you can see in this picture, this very slender, tiny structure within this cell is basically an OR rod. So, these OR rods are the needle shaped pink or red structure that is found within the myeloid cells. Myeloid cell means those cells, those are capable of making mature neutrophil, eosinophil, basophil, or any other cells like monocytes. So, myeloid cells, they usually show presence of OR rods. But this is important, especially in context of acute leukemia. It helps to differentiate between acute myeloid leukemia from acute lymphoblastic leukemia. Now, this acute myeloid leukemia blast cells, they show the presence of OR rods. So, OR rod is a characteristic feature of myeloid precursor cells or myeloid blast or acute myeloid leukemia. Now, the question is, what are the constituents of these OR rods? Now, these OR rods are made of the contents of the azurophilic granules. That means it contains different enzymes such as myeloperoxidase, acid phosphatase, and esterases. So, this tiny, slender, needle-like structure is basically comprised of different enzymes, and this is a feature of acute myeloid leukemia. Now, let's come to the second inclusion. This condition is known as basophilic stippling, and these basophilic stippling, these are basically small blue dot-like structures in the RBCs. So this is one RBC, and as you can see, there are multiple very tiny bluish dot-like structures within this RBC, and these bluish structures are basically the basophilic stippling. So this is seen in case of lead poisoning, heavy metal toxicity. It is also found in different hemoglobinopathies like thalassemia or sickle cell anemia. Also, it is found in different nutritional deficiencies like B12 deficiency, and it is also seen in myelodysplasia. So, this condition is also a non-specific condition, so that this basophilic stippling can be seen in the other lot of conditions. Now, coming to the next inclusion. So, the next inclusion, that is the Cabot ring. Here in this image, you can see that there is one ring-like structure that is present within this RBC, and this ring-like structure is basically a Cabot ring. So, this is a thin red-violet thread-like structures. Sometimes it forms a figure of 8 structure within the RBC. So, this condition is seen in acute myeloid leukemia, chronic myeloid leukemia, myelodysplastic syndrome, chronic myelomonocytic leukemia, but this is also not specific for any of these conditions. So, this is also a non-specific finding. It can also be found in case of vitamin B12 deficiency also. Now, other conditions such as different medications use also in case of dyserythropoiesis, you may find this type of abnormal ring-like structure. Now coming to the next interesting inclusion body, so that is dole body. Now this dole body, as you can see that here this bluish, let me show you clearly. This bluish structure, this is a dole body. Now this is a small round oval pale bluish gray structure, and they are usually found at the periphery of neutrophils. So you have to remember that these dole bodies, they are usually found within the cytoplasm of neutrophils. And these dole bodies, they are comprised of aggregated ribosomes. Now, this is found in sepsis, burns, leukemia, after chemotherapy. So, it can be seen in various conditions. Now, let's come to the next inclusion, that is HBSC inclusion. Now, what does it mean? Now, if someone inherits one copy of sickle cell gene and another copy of HBC gene in a compound heterozygote form, then this is known as HBSC disease, and it can present like a sickle cell disease, but the symptoms are milder. Now, these abnormal structures, they are seen like this, the shape of a hand-like structures, and these are the features of HBSC inclusion. Now coming to the next inclusion, that is Heinz bodies. Now these are tiny dot-like structures within the red cells. These are the structures which are formed due to damage to hemoglobin, usually from oxidative stress. So, if there is any oxidative stress within the red cells, then the hemoglobins are degenerated, or better to say, hemoglobins are denatured, and they form these dot-like structures, and they are Heinz bodies. So, they are seen in various blood disorders, including some inherited conditions. Especially, there is one condition called G6PD deficiency, or glucose 6-phosphatase dehydrogenase deficiency. So, here in this condition, you can find this Heinz body in RBC. Now, coming to another interesting inclusion, that is Howell body. Now, what is a Howell body? It is a nuclear remnant found in the red blood cells. So, during the course of RBC maturation, as we know that in the initial phase of RBC development, from the stage of proerythroblast, that is the most primitive form of erythroid cells that resides within the marrow. Then there is formation of uh, orthochromatic normoblast, then late normoblast, then reticulocyte, and finally a mature RBC. Now, what is the difference between a reticulocyte and an RBC? Reticulocytes, they still contain some nuclear remnants within the cells, but mature RBCs, they are devoid of any nuclear remnants. Now, this at this stage of maturation, there is loss of the nuclear material from the reticulocytes, and after loss of these nuclear materials, these reticulocytes, they form mature RBC. So, if there is any defect, these nuclear remnants, they are not lost from the reticulocyte, and they can give rise to this Howell jolly body like structures. So these are found in post-splenectomy condition, in sepsis, sickle cell disease, in alcoholism, in some autoimmune disorders. They can also be seen post bone marrow transplantation or in megaloblastic anemia. Now coming to the next uh, inclusion, that is Papenheimer body. So these are basically, they are small iron containing granules. These are the iron containing granules, as you can see. And these granules, they appear blue in pearl stain. So these bluish or dark colored granules, they are basically Papenheimer body. They are composed of iron, and the presence of this Papenheimer body, that indicates some pathological states. So they are most likely caused by accelerated red cell division or impaired hemoglobin synthesis. They are found in patients with no spleen or asplenia, even or after splenectomy. The patients, they are caused by defects in hemoglobin synthesis. They are present in some congenital sideroblastic anemia, lead poisoning, etc. Now, coming to the last inclusion, that is the toxic granules, and it is seen within the neutrophils. So the toxic granules are a common condition that affects the white blood cells, often associated with inflammation and infection. Especially, we found this most of the times in infections, some kind of infections. The presence of these very large granules within neutrophils, they indicates some kind of infection that is going on, and the infection as the most common cause, sepsis. It is associated with neutrophilia. That means whenever you can you detect any toxic granules, you will also be seeing some neutrophilia. That means increased number of neutrophils.